Good evening and welcome to yet another edition of Radio Bridge. This time, we connect the stations of Guwahati, Kohima, Imphal and Shillong, and to discuss a very relevant and important topic that concerns the safety and health of each and everyone. Today, we discuss the medical preparedness in the northeastern region against global Covid-19 or the coronavirus. To discuss this important topic, we have Dr. John Kemp, State Surveillance Officer, Department of Health and Family Welfare, Nagaland; Dr. Achut Baisha, Executive Director, NHM, Guwahati, Assam; Dr. Bharat Ningombam, Epidemiologist, Directorate of Health Services, Government of Manipur; and Dr. Robert R. Marak, District Surveillance Officer, IDSP, East Khasi Hills, Government of Meghalaya, who will be joining us in a short while. Well, what started off in faraway Wuhan in China quickly spread across China and then to different parts of the world through community contacts. That is, person-to-person contact. It being a new mutation of the corona family of viruses, there was no knowledge about its modes of transmission, and there still is no vaccine to cure it. Though research for the development of a vaccine has already started, it will be at least a year before one is commercially available. This means that for the moment, prevention is the best cure. To discuss the various issues at the home level, community level, and state level, so that in the event of an outbreak, we are ready to tackle the situation, let me first go over to Dr. Bharatin, Epidemiologist, Director of Health Services, Government of Manipur. Doctor, are you there? Can you hear me?
Good evening.
Wonderful. Welcome to our program.
Thank you, sir.
Let's start off with this. What is the status of the disease in your state? Are there infected people? And what is their status?
As of now, we do not have any infected people. We have been preparing ourselves. We have been gearing up to deal with any infected people. We have already started screening at Imphal Airport since 18th of January and the 6 surface points of entry since 31st January. And isolation wards
are with Myanmar or
yes,
within
Myanmar.
the state, with India, and other states of India also?
Yeah, and the domestic surface points of entry also.
Okay.
And as of now, we have screened more than 1 lakh passengers at Imphal Airport and the surface point of entries, and more than 300 that are meeting the case definitions and are coming from the different countries that have been listed by Ministry of Health and Government of Health and Family Welfare.
Government of India.
It has been going on.
And so you said 300 of them have met so far those conditions. So what do you do with them immediately?
As of now, most of them are asymptomatic. So what we do is, the district surveillance of teams, they verify them. Then they are given the IEC material and what to do when they develop the symptoms. And the monitoring will be for 28 days.
Okay, so not 14. You're doing it for 28 days.
Yes, because this is a novel virus, and as per studies and reports, it is reported to be of about 14 days. So we are not taking any chances, and we are doing it for 28 days, twice the incubation period.
So there is almost, you leave nothing to chance.
Yes, sir.
Good. Let me move on to Guwahati. And in Guwahati, we have Dr. Achut Baisha, Executive Director, NHM. Dr. Achut Baisha, can you hear me? Dr. Baisha?
Yeah, are you hearing?
Yes, now I can hear you. Yes, wonderful. So, Dr. Baisha, what is the status of COVID-19 in Assam? Yesterday, we read a very disturbing news. What is the update on that?
You see, at this moment, we are having no case reported in the state. And till now, we are not getting any case. But we are prepared fully. Till today, we have no case in the state. But last 28th of January, we are having the screening in the airport. Then, as per the guideline of the protocol of the WHO, we are...
Yeah, just continue. It's okay.
I can continue, but it is disturbing now. But it is echoing in my ears.
I can understand. It is echoing in my ears too. Let's continue the discussion. Hello?
Yeah.
Okay, let them set it right. Let me go back to Dr. Bharati. Yeah, Dr. Bharati, as part of the preparedness and community sensitization is one important part. Removal of fear, panic, and then disseminating of the correct information. So how is all this being done?
In Manipur, the district teams, they are doing the awareness at the district level, at the community level. And at the state level, we are doing at the state level for the district level teams. And IEC in print and electronic media is being done regularly, and the latest has been done yesterday. And most of the discussion hours in our local TV channels is focused on that only.
So you are using print material as well as electronic media?
Yes.
And in the local language?
Yes.
Does it ensure that it reaches 100% of the population? Does your TV and radio have that reach?
We are thinking that it will reach, and apart from that, we are also using the help of and support of the community workers, like the ASHA workers,
right?
So that they can disseminate the information to their local persons. That is the most effective way.
There is a section of the working class who are not at home when TV programs go on. They are, let's say, taxi drivers, just as an example. Taxi drivers, or people who work in hotels as waiters or desk staff. These people, most of the time, don't get to see these or listen to electronic media. And many of them also are not literate enough to be interested in reading newspapers. And they form a large section of society who could be vulnerable carriers, who themselves could be vulnerable as well as carriers. How do you plan to target them?
Yesterday, our Chief Secretary convened a meeting of all the important stakeholders that included the Department of Tourism and Department of Home and Department of Transport. So we are going to disseminate the information to all these classes of people that has been prepared, and it is going to be disseminated soon.
That is one part, preparing the community and sensitization and information dissemination. The other is the protocols that must be in place in the hospitals. Are these protocols already there?
Yes.
And what are those things that are being done in the hospitals so that in the event of an outbreak, things can quickly be handled?
Regarding the protocol in the hospitals, every hospital, designated hospital as of now, the tertiary hospitals like the REIMS and GENIMS, they have their own novel coronavirus committee. It consists of around 15 persons, and it is being chaired by the medical superintendent. So in case any person or any suspect is being referred to the tertiary hospital or this designated hospital, they will be dealt as per the protocol and guidelines given by Ministry of Health and Family Welfare.
Government of India.
Yes.
Okay. Is a rapid response team in place?
Yes, it is at the state as well as the district levels.
And they have been trained how to handle and all the medical equipment.
And even today also, there was a Zoom conferencing with the Ministry of Health and Family Welfare. There was a WHO training going on, and many of the district RRT teams were participating through Zoom.
Wonderful. Let me just 1 minute try to go back to Kohima and see if we can connect with Dr. Kemp. Dr. Kemp, are you there?
Yes, please.
Wonderful. Nice to have you. Welcome to our program. So I was asking the other people who I've been able to talk to, what is the status of the disease in Nagaland?
In the state of Nagaland, as of now, we are yet to come across any suspected case. So as of now, we have not sent any sample for confirmation. So we have no case.
I see.
At the moment.
But you're ready.
When it comes to the preparedness status level, we are ready.
So what kind of preparedness have you all undertaken already?
All this preparedness level is based on the guideline and the SOPs provided by Ministry of Health and Family Welfare, Government of India. Now, we have from our State Public Health Emergency Operations Center with Command Center operationalized on the 28th of January this year, 2020.
Please continue.
We have been giving daily surveillance report to Central Surveillance Unit, Delhi, Government of India, and all our district surveillance unit, they are alerted and are on maximum vigils. Our rapid response teams, they have been activated, and we have, as of now, we have prepared a total of 52 beds for isolation in public hospital and military hospitals. Now, personal protective equipment, PPE, and 95 masks and handheld thermal scanners have been provided to some of the identified priority districts, including Dimapur Airport team.
So is that going on already at the airport?
Screening for all travelers from China and affected countries has been started from the 30th of January 2020. And as of now, We have screened 2,040 persons with travel history to China and affected countries, and they are all on surveillance. Out of the 236 persons, now cumulative, when we talk about the cumulative, there were 19 under home isolation, and as of today, 6 p.m.,
Okay.
6 March 2020, now we have only 5 under home isolation because
Okay.
the rest of them, they have finished their isolation period.
And what is the isolation period you all are specifying? 14 days or
This
28
is
days?
for 28 days,
28 days.
as directed by Government of India.
So these people who are in home isolation has a history of travel?
Yes, they have travel history from China and affected countries. So accordingly, as per the SOP provided by Ministry of Health and Family Welfare, Government of India, we have kept them under home isolation.
So I'll come back to you, Dr. Kemp, again. Let me go to Guwahati. Dr. Baisha, can you hear me now?
Yeah, I'm here.
Wonderful. So, Dr. Baisha, tell me, please continue where you left off. You said since January 28.
We have started the screening of this coronavirus in the airport on 28th of the January, and we have got a screening in all the 6 airports. We have got around 7 teams going to the screening. We are fully prepared to take it.
Okay.
And all the 6 medical colleges, we are preparing as a tertiary center for the treatment.
Mhm.
If someone comes, until that, we are having some cases, not cases, they are the suspects. Somebody came from the Kerala, somebody came from the Wuhan city also. All are being free and all are being tested negative, and
Okay.
we send the samples. As well as we had this severe viral laboratory in our Guwahati Medical College, and it has been out of 15 laboratories, because the hospital is designated free. Of India, and all the protocols for the screening, then the testing, the diagnosis, then we are following the protocol of the Government of India, and till that we are screening more than 550 people in the airport.
Okay.
All the 6 airports. We are sending around 7 samples we have tested. All are negative. We are having the fully prepared with this protective gear. We have got the N95 mask, PPE, protection equipment, which are very prepared for the
This is all for the health
handling
workers.
the cases, the transportation, keeping 2 ambulances ready in the all the airports ready, so that if somebody comes suspect, so that we can transport to the tertiary centers.
Okay.
And even for the quarantine, who are coming in contact or who are not expressed symptoms, we are keeping some facilities ready so that we can quarantine them for the 28 days.
How many beds have you
We
ready?
are suggesting till date we have around 107 people who are under the home surveillance. Out of that, 77 has been already been released after the 28 days. 86 has been released. Out of that, 28 days of the screening by the ITSP team in their respective homes, we have released them from the surveillance. This is the status. As on today, we are not having any case, but we are taking precautions. We are going for the awareness in the newspaper. We are going for the awareness in the TV. Even with the stakeholder departments, for the tourism department, we have briefed them what to be done in the hotel areas particularly, and we are taking regular meetings, and we are
Okay.
keeping their place. They are going to the TVs and radios and even newspapers, and we are doing regularly. And we have got some this land port also, particularly entry point for the Bangladesh, entry point from the Nepal. We are not having the direct entry from the Nepal, but Bhutan we have got a direct entry
Right.
point.
Right.
We have got the screening point here.
Okay.
In case of the BPAD area, we are having the screening point. Then now we are maintaining this screening in this Kariimganj also for Bangladesh. In nutshell, we are fully prepared to tackle and so that, because as you told beginning that we have no treatment, we have to prevent it only.
Absolutely.
So now we are going to give all the IC material, do's and do not. That what can be done, what could not be done, and how to work, how to avoid this crowd. Then in case of hospital, what to be taken precaution,
Wonderful.
hand wash.
Okay,
Personal
so
protection.
I'll come to that.
And
I'll come to that in a
doing-
while. Just hold on there, Dr. Baisha. Thank you so much for contributing and talking to us about the preparedness in Assam, particularly in Guwahati. We are just joined by Dr. Robert R. Marak, District Surveillance Officer, ITSP, East Khasi Hills, Government of Meghalaya. Welcome to the program, Doctor. So I was asking everyone to start off with, what is the status of the disease in the state? So what is the status of the disease in Meghalaya?
All right. Good evening, everyone. So actually for Meghalaya, we received information about the outbreak on 24th January 2020. So since then, our government has been really preparing to contain this disease so that it doesn't come to Meghalaya. Since January itself, we have been having the state task force meeting, and then we have been having the district task force meeting, and then the commissioner, secretary health, as well as the director of health services Meghalaya had sent an advisory to the airport at Umroi, since we have one airport, domestic airport here.
Right.
So we have sent an advisory to Umroi airport as well as to Guwahati airport, and we have also met the director in charge there, the counterpart of the health services in Assam, so that any passenger coming from any of these affected countries should be screened at the airport itself, and then they should fill up a self-declaration form telling that we have, yes, come from these affected countries, we have visited so and so place, and we are having a symptom of this and that, or we don't have symptom of fever, cough, and fullness of chest. And then we have also shared with them our toll-free number, that is 108. So this toll-free number works 24/7 in Meghalaya.
Both landline and mobile.
Yes. They can call either through landline or through mobile. And then the call operator from 108 would then direct the passenger what to do next.
Okay.
In case he develops symptoms, like call operator would tell him that you self-isolate yourself at home, avoid going to public places, self-isolate yourself for at least 28 days. That is the direction given by the ministry. Another thing we had done is that we had also given a health advisory to the education department as well as to the tourism department, in case we miss out on any tourists coming to Meghalaya. The advisory given to the education department is that they should inculcate cough hygiene as well as hand hygiene. Teach each and every student, especially during the assembly period, on how to wash their hands sanitarily and not to touch their nose, mouth, or eyes with unwashed hands. And then in case you develop any of the symptoms of influenza-like symptoms, cover your nose, mouth, and avoid going to public places. These are some of the precautionary measures the state had taken. And we had also trained the rapid response team. I think this has been done by all the states. So every district has a rapid response team. Since the outbreak was informed to us, every rapid response team in each district was formed, and it's the work of these rapid response teams to do a follow-up of any of the passengers who come from the affected countries for 28 days. We have also identified hospitals at the district level where passengers coming from the affected countries could be isolated.
Okay.
Right.
So in Shillong, what are those?
In Shillong, we have Civil Hospital Shillong as well as Negrims. And then
Military hospital?
Yes. We also have a military hospital and the 6 private hospitals which are in Shillong. We have also involved them. And we just yesterday itself we had a state task force meeting chaired by the Commissioner of Health Services himself. Advisory was shared with each of these private hospitals, and then all the private hospitals were asked to be prepared with personal protective equipments, isolation wards, earmark the isolation wards in case you don't have. You can convert the private rooms into isolation wards and be prepared with a mask and personal protective equipments.
So how many beds in total are envisaged for at the moment in Meghalaya? Would it be around 50 at least? 50 beds?
For Meghalaya, in total we have 33 beds.
That's in Shillong only, or the whole of Meghalaya?
That's the whole of Meghalaya. And then in Negrims they have earmarked another additional 30 beds.
Wonderful. The other concern, when I think about this, is that there is a large section of people who really don't get to see the part of the dissemination of information that governments do. I'm sure Government of Meghalaya is also disseminating information on how to handle this problem. Say, for example, I was telling a little while ago in this discussion, taxi drivers, people who are in hotels as waiters or desk staff, they really don't get to see the TV or listen to radio. How do you reach them? Many of them are not literate enough to be able to read when you write something on a newspaper. or give them a pamphlet.
Right.
How do you reach them? Because these are vulnerable people. Taxi drivers are ferrying these people. So how do you reach them?
From the Department of Health, what we have done is that we have made sure that the message goes to each and every individual, literate or illiterate. What we have done is we have sent out advisories through the radio FM, both in English as well as the local languages.
Okay.
We have done this for 7 days, and then we also had in local TV channels. All these have been done
Okay.
by us.
Are you thinking of initiating some WhatsApp messages through organized, structured WhatsApp messages, just like information has been otherwise spreads around? So take advantage of this.
Yes, we are doing this on a regular basis. We have a WhatsApp group, and whatever advisory is required to be shared to the public, we are doing that. We are sharing it through public and WhatsApp. Even tomorrow also we'll be sharing both in English, Khasi and Garo the advisory on do's and don'ts, what public should do in case they develop fever or in case
Okay.
yes they
We'll come to
from
the
these
specifics.
affected
We'll come to the
countries.
specifics just now. Let me go to Dr. Kemp in Kohima. I wanted to know, since no treatment really is available, and Nagaland is that way lucky that there are no cases at all so far. Statistically, what is noticed? Who is more vulnerable?
At this point of time, as per the SOP, we are not trying to discriminate any type of people here, because any travelers or passengers from any of these affected countries could be a potential carrier for this virus. So accordingly, what we are doing at the airport, we are going for thermal screening, and at the same time we are going for IEC on a war footing. Now our IEC, it has been done through All India Radio, both in English and local dialect, and it's been done through Doordarshan, and at the same time through our local paper, both in English and local dialect. And like today, we had the state task force meeting under the chairmanship of our chief secretary, and at the same time, we had a video conference with all the district commissioners. Now, wherein IEC will be taken on a war footing right down to the grassroots level.
Sir, would you be able to share a telephone number that people would want to call in case they suspect something or would like to, take help?
Oh yes. We have the state helpline. In fact, we have 3 numbers.
Right. Please announce them for Nagaland.
Okay. The first number is 7005415243. The second is 9856071745, and the third number 7005536953. This helpline is of 24/7.
Thank you so much. Let me try and go over to Guwahati. Dr. Baisha, are you there? You were talking about the preparedness, the screenings that are available at the airports. What about training of the rapid response team? Is that complete also?
Rapid response team, actually, this what about the universal precautions to be taken by the rapid response teams for any eventualities are the same. During this January, WHO was training all the northeastern states, rapid response teams for the any emergency preparedness from the IDSP were trained in Guwahati for 3 days. So the team is with us. It comprises of microbiologists, it comprises of the public health, it comprises of the medicine specialists.
Right.
So each medical college has got the rapid response team. Its state headquarters has got the rapid response teams. Even in the district level also, we have got a rapid response. And this team are being prepared, already being...
Okay. What about testing centers?
There was a video conference from the Delhi, and training was conducted, which could be zoomed. And in all the district headquarters, all the state headquarters, even we are sending our this IDSP team to Delhi for the training, clinician, microbiologist, media expert, and as well as the surveillance officer, nodal officer, to Delhi for the training. WHO is organizing this and one-day training. The same training has been seen and shown to the district headquarters, to state headquarters, and all the rapid response team, all the nurses. We call in Guwahati all the nursing homes because they also should be prepared equally.
Good.
So we had a regular meeting with the nursing homes. They have been briefed what to do, what not to do. Because at this moment we should not be panic. It is only the precaution.
Exactly.
Only the precaution, only the prevention.
That's right.
And this prevention is only if someone is from these 12 or 13 countries are coming, and if anyone from the contact of this any case, or if they are returning from this country, and they have to give a self-declaration in the airport, and based on that they are screened, and if they are symptomatic, they are referred to the hospital. If they are not symptomatic, we are requesting them to be home confined,
Okay.
so that it is better. Always a home confined is better, and maximum 28 days, double the incubation period.
Good.
The rule is that
All right. Dr. Baisha.
international rule is that double the incubation
Dr.
period.
Baisha, what I
It should
understand is these protocols are common to all the
protocol.
northeastern
Yeah,
states.
double the incubation
Right.
period. It is the incubation period is 2 to
14,
days.
correct. So
double
you're
the
taking
incubation,
28 days.
If,
So it is the-
and if somebody are suspect and in hospital, then at least as per the protocol, there should be 2 samples negative.
Right.
So after the 2 samples are negative, they are discharged.
He can be discharged.
And,
Right.
and one good thing is that out of this coronavirus throughout the world, 94% are discharged and recovered. And this only this, I think now the death is crossing 3,300 now. So, but thing is that the death rate is around 3.2 or 3.4%. And
Okay.
only
Dr.
the
Baisha,
prevention,
I have
only the
another
prevention of the
question.
contact and confining the contact surveillance will help.
We are almost at the end of the program. Dr. Marak, what about testing centers?
The identified center for northeastern states is NICET Kolkata. So that is the nearest center for us. And our collection center is Negrims Hospital. So if we get any passengers traveling from these affected countries, any of the districts having such passengers should inform the rapid response team, and they would do the collection and send the sample to Negrims. Negrims in turn would have to send it to NICET Kolkata or NIV Pune.
Northeast has been trained together by World Health Organization. What is your assessment of the level of preparation for the entire Northeast? Just in 10 seconds.
As of now, I think we are quite prepared, but then we have still lot of pockets where we really have to take care of, especially the border areas, border immigration areas,
porous areas.
and sharing of data, I think, is very important between the states.
Thank you very much. Wonderful talking. And what we understand is that the northeastern region is pretty well prepared. All the things are in place. All the protocols are in place. And screenings are in place. Thank you very much. Wonderful talking. I hope this has gone down well and will go a long way in relieving a lot of tension and unnecessary panic. Thank you very much. The producer of the program was Jay Gangte, and the engineer on duty was R.C. Schiller. Thank you very much. This came to you from the Northeastern Service of All India Radio.